Ballet, a demanding art form, both physically and emotionally, comes with unique expectations of strength, flexibility, technique, artistry, stamina, and discipline. In this video, we will introduce common injuries sustained through ballet dancing, how to prevent these injuries from occurring, and what you should do to aid rehabilitation in the event of an injury. The most common injuries in ballet occur in the foot and ankle. Through CT data modeling, we have created a foot model to demonstrate anatomy and injury of the bones and tendons of the lower limb and foot.
This model shows select structures and is not a direct representation of all the structures present in the foot and ankle joint. Here we are facing the medial side of the foot, meaning the inner part of the foot. The bones can be seen in yellow. This bone is the tibia or the shin bone. Below this bone is another bone called the talus. Then even more inferiorly is the calcaneus bone. Here we are facing the lateral side of the foot, meaning the outer part of the foot. This bone is the fibula, which is found above or superior to the talus. The bones which make up the true ankle joint are the tibia, fibula, and talus. This means that the tibia and fibula slide over the talus when the foot is flexed and stretched. At the back of the ankle is the Achilles tendon, shown in green, which inserts onto the calcaneus. This tendon originates from the calf muscles. Shown in red is the Flexor Hallucis Longus tendon. It is called so because it plantar flexes the ankle joint, midfoot, and the toes, particularly the big toe. Plantar flexion is when the foot is moved downwards or away from the body. For dancers, this is known as pointing the feet. The Flexor Hallucis Longus tendon inserts onto the base of the big toe and originates from the Flexor Hallucis Longus muscle, which is one of the calf muscles. Another structure present in orange is the sural nerve. The sural nerve innervates or supplies sensory perception to the lateral last third of the shin and to the lateral side of the foot.
This video will cover two injuries, Flexor Hallucis Longus Tendinopathy and posterior ankle impingement.
Flexor Hallucis Longus Tendinopathy can be diagnosed by the dancer experiencing pain through motions such as jumping and landing. Whilst posterior ankle impingement can be diagnosed by the dancer experiencing pain during the maximal plantar flexor position. These injuries often exist simultaneously and can arise from overuse. When a dancer increases their hours of practice per week, these movements are performed more frequently, making the dancer more susceptible to injury. Another reason for these injuries arising is attributed to bad technique. Dancers without ideal 180-degree turnout may feel they have to force turnout, including getting to the first position by bending their knees, turning out to their maximum, and then straightening their knees. This causes rotational stress at the medial aspect of the knee and torsional stress on the tibia. This stress propagates into the feet, causing foot pronation, also known as rolling the instep inwards. This puts pressure on the medial side of the foot and the big toe as well, causing the Flexor Hallucis Longus tendon to be put under strain, and can also cause compression on the lateral side of the ankle and the Achilles tendon. Rather than forcing turnout, it is important to place the first position using the rotation present at the hips, and supporting this by engaging the external rotators to maintain this turnout throughout class.
Flexor Hallucis Longus Tendinopathy is one of the more common causes of posterior ankle pain. Dynamic, repetitive movements can cause inflammation of the Flexor Hallucis Longus tendon, called tendinitis, or can cause inflammation of the tendon as well as its sheath, called tenosynovitis. This inflammation occurs as a result of compression of the tendon within its sheath during specific movements such as moving the foot into a pointed position and then back to a flat position by jumping, releves, and rises. Rolling of the foot can also lead to strain on the tendon, further exacerbating the issue. Rolling the foot is more likely to occur to those who have weak or flexible ankles performing on point, or those who do not follow proper technique. To reduce the risk of Flexor Hallucis Longus tendinopathy occurring, it is important to rest the foot when pain occurs during jumping, rises, and releves. If you are planning to increase your weekly hours, do so slowly over time. Strengthening the foot before commencing point work through many rises to demi-point is important to ensure the dancer is strong enough to perform various movements on point. It is also important to ensure proper technique is being followed throughout class, and movements are not attempted before they have been taught meticulously. If you are experiencing pain during jumping, releves, and rises, let your teacher know and visit a health professional, as this may be caused by Flexor Hallucis Longus Tendinopathy. The technique used in rising is especially important to prevent Flexor Hallucis Longus Tendinopathy, as this translates to the movement used in jumping and releves. The following videos will demonstrate proper and improper technique when rising. Here the dancer is demonstrating good technique when rising to demi-point. The turnout starts from the hip socket. She is using the abdominal muscles and the external rotators of the glutes to maintain turnout. The knees are tracking over the toes with the weight evenly distributed across the toes. Here the dancer is demonstrating bad technique when rising to demi-point. The turnout is not occurring at the hip joint, but instead is being forced at the ankle. This means the knees are not tracking over the toes, causing torsional stress at the knees and at the ankle joint. The ankle has become rolled inwards, and this makes it hard for the dancer to maintain balance, as the weight isn't evenly distributed across the toes and is located more on the big toe. This has also reduced the dancer's range of flexibility in the instep and makes the dancer susceptible to injury. Here the dancer is demonstrating good technique when rising to point. The turnout starts from the hip socket. She is using the abdominal muscles and the external rotators of the glutes to maintain turnout. The knees are tracking over the toes with the weight evenly distributed across the toes. Here the dancer is demonstrating bad technique when rising to point. The turnout is not occurring at the hip joint and is being forced at the ankle. The knees are not tracking over the toes, causing torsional stress at the knees and the ankle joint. The ankle has become rolled inwards, and the weight is not distributed evenly across the toes, with more weight placement on the big toe, so the dancer will find it hard to balance and will be susceptible to injury, especially rolling the foot. Posterior ankle impingement, also known as dancer's heel, is a common injury which causes pain characterized by a pinching pain towards the back of the ankle when going up into the demi-point or on-point position, but most notably in the fully plantar-flexed position. Impingement is caused by rubbing or pressure on tendons or nerves in the back of the ankle space, which leads to stress on these structures. These tendons or nerves are often the Achilles or Flexor Hallucis Longus tendon and the sural nerve, all of which can be found around the back of the ankle. Impingement on these structures occurs following repeated movements such as releves, where the impinging structure can either be soft tissue or bony structures. Soft tissue impingement is caused more by inflammation, whilst bony impingement is caused by bony spurs like this bony spur shown here. This bony structure here is known as the os trigonum, and it is found on the posterior lateral side of the talus bone. Posterior lateral meaning the lateral aspect of the back of the talus. The os trigonum can arise during puberty when a process called secondary ossification occurs. This is the process of cartilage present at the ends of the bones turning into bone, so that no more bone growth and length can occur. This usually coincides with dancers increasing their weekly dancing hours, which can put stress on the bones, contributing to the development of the os trigonum or bony spur. In 50% of patients presenting with posterior ankle impingement syndrome, this bony spur will be found. To reduce the risk of posterior ankle impingement syndrome occurring, a dancer can reduce the stress on the structures which run through the posterior ankle space by resting the foot when pain occurs during full plantar flexion. Gradually increase weekly dancing hours to prevent excessive load on the bones. Ensure proper technique is being followed to prevent potential inflammation of the soft structures, which could cause impingement. If you are experiencing pain during full plantar flexion, let your teacher know and visit a health professional, as this may be caused by posterior ankle impingement. Depending on what is the cause of the impingement will determine the treatment option, which can usually be identified by X-ray or MRI. Risky moves such as point work should be avoided, with only non-weight-bearing exercises allowed. Resting during this injury is very important, as this will prevent further inflammation from occurring. The following videos will demonstrate proper and improper technique during releves. Here the dancer is demonstrating good technique when releveing to demi-point. The turnout starts from the hip socket. She is using her abdominal muscles and the external rotators of the glutes to maintain turnout. The knees are tracking over the toes with the weight evenly distributed across the toes, instep and heel. Then during the snatch of the releve, the weight is then evenly distributed across the toes. Here the dancer is demonstrating bad technique when releveing to demi-point. The turnout is not occurring at the hip joint, but instead is being forced at the ankle. This means the knees are not tracking over the toes, causing torsional stress at the knees and at the ankle joint. This makes it hard for the dancer to maintain balance, as the weight can't be evenly distributed across the toes, and is mainly placed over the big toe. This also makes the dancer susceptible to injury. Here the dancer is demonstrating good technique when releveing to point. Turnout starts from the hip socket. She is using her abdominal muscles and the external rotators of the glutes to maintain turnout. The knees are tracking over the toes, with the weight evenly distributed across the toes, instep and heel. Then during the snatch of the releve, the weight is evenly distributed across the toes. Here the dancer is demonstrating bad technique when releveing to point. The turnout is not occurring at the hip joint and is being forced at the ankle. The knees are not tracking over the toes, causing torsional stress at the knees and the ankle joint. The weight is not distributed evenly across the toes, so the weight is mainly placed over the big toes. The dancer will find it hard to balance, as she is not fully on the platform of the point shoe, and will be susceptible to injury, especially rolling the foot.
Listening to your body is key to injury prevention. Rest when you are tired. If you are experiencing pain, stop dancing and go to a health professional. Communicate what the doctor or physio has told you to your teacher and follow their advice in class. Although a foot injury may at first appear limiting in what you can continue to do, it gives an important opportunity to work on flexibility, core strength, and upper body alignment. Thank you for watching.